And for more now, Christina Ruffini joins us from outside of Walter Reed Medical Center. Christina, what have you been seeing there on the ground?
Lana, good evening. So we arrived about an hour ago, and almost as soon as we got here, you could see everybody on this overpass here looking behind us. And that's because the president was coming in over chopper. They came in this way, and then one of the choppers, because remember, there's only one Marine One, and that's the one the president is on, landed right here behind my right shoulder. The president then exited the helicopter. He gave a bit of a wave to a TV pool that had been preset in that position, got in the Beast, which is his limo, and was whisked away towards the tower that you see behind me. Now, we have reports that the president didn't stop in the emergency room. He went directly up to the presidential offices, and this is a part of the hospital designed to basically be a home away from home for the president. It has everything he would need to conduct the business of the country, and it has, some of the creature comforts that he would be used to at the White House. Now, the president has not transferred power to the vice president, and staff at the White House says he's still working, and he plans to, like many Americans, work from home, only now his home will be Walter Reed Medical Center behind me.
Christina, I'm wondering, and you might not have this information yet as everything is still developing. We saw as the president got on board Marine One that the First Lady, who we know has also tested positive, was now with him. Do you know anything more about who is with the president and as he's working from home, if he will have access to any of his family members or anything more about the First Lady's health?
We haven't heard much about the First Lady, except, as you noted, it was noticeable that she wasn't on the helicopter with him. But you have to think, it may be easier to handle just one high priority patient at a time. We know the Chief of Staff, Mark Meadows, came in with him and went in the car with him and went up to the hospital. We're unclear. The First Lady is younger. She's 50. The President is 74. She seems to, by all accounts, have been doing a little better. She doesn't seem to be exhibiting symptoms that would precipitate her move to a facility like this. So again, we're just speculating. Perhaps the staff here wanted to focus on the president. Perhaps they could both get more rest if they took their own space and then, kind of separated and focused on what is ailing each and every one of them. But what we have heard almost universally tonight from Republicans and Democrats is wishing the president well and a speedy recovery, and that this is a reminder of how serious this disease is and how it can go from stable to pretty serious very quickly, which is why they've moved the presidents here over an abundance of caution. They're stressing that. And as you might have seen, he actually made a video before he departed the White House as kind of a show of confidence. He was standing, he was in a suit. He seemed a little subdued, but more or less okay, and thanked everybody for the well wishes and said, he's heading here, which is one of the best hospitals in the country. And, thank you so much for the outreach. And basically I'll be in touch soon. And hopefully he will do well and be back in the Oval Office before we know it.
And Christina, you've also been covering Capitol Hill. Can you tell us anything more about how lawmakers have been reacting to the president's diagnosis beyond, as you said, hearing from Republicans and Democrats' well wishes?
Yeah, so lawmakers are concerned about a couple things. First of all, obviously they're concerned about the president, and then they're concerned for their own health and safety, especially Republicans who are close to the president and who have been physically close to him over the last few days in rallies and campaign events. And of course, we had the nomination of his Supreme Court nominee, Amy Coney Barrett. And they're also concerned about her nomination process. And if the president is sidelined, what that means for their ability to push a nomination that's already controversial through ahead of the election. They're also talking about what this means for their protocols, their security, their safety. And they're talking about the stimulus package, because this is yet another reminder coming ahead of November's vote that this virus is serious and it's taking people out of the game. And, when you have your commander-in-chief being sidelined because he's not feeling well, again, he's stable. This is an abundance of caution, but it's a really undeniable reminder that this is serious and a lot of people are out of work. So that's going to put more pressure on the Hill to do some sort of stimulus package and pass something that says, we understand the magnitude of this virus. The leader of our own party has been stricken with it, and we are here to help you, American people. Please vote for us in November.
Yeah, it is difficult, as you say, that there is the backdrop of the election taking place in just 30 days' time, or as somebody else said, the deadline for the election, as many people have already started voting in several states. And I want to update our viewers as well that we have confirmation from the Trump campaign that they do not plan to remove negative ads targeting former Vice President Joe Biden, despite the Biden campaign's decision to try and remove negative ads against President Trump, given the current situation. So it does seem like politics already rearing its ugly head when it comes to trying to move beyond that, to see this as a public health crisis for all Americans. Does this mean in what you have seen and what you have been hearing from lawmakers that a stimulus bill is more or less likely, or is the situation right now so fluid, so chaotic that it's really too hard to say?
I've heard today that there is more support, there is growing support for another stimulus bill, but again, there is so much going on in the country, on the Capitol. There's so much work to be done ahead of that November deadline that anything is far from certain at this point. And going back to what you were saying about, politics already starting to rear their head with this issue, this is a deeply divided country and a deeply divided Washington right now, and one of the most physical manifestations of that divide has been the issue of mask wearing itself. It's almost a party split down the middle, especially on the Hill. You see the Democrats and their staff wearing masks and the Republicans not, and their staffers not, even when they are in close proximity. Or in President Trump's case, when he was with senior staffers like Hope Hicks, who was diagnosed with the coronavirus, for the most part, as far as we know, in photos and anecdotally, they don't wear masks. They've been relying on those rapid tests to say, okay, it's safe to come in because you tested negative. But again, as we're learning with this virus, a negative test once doesn't necessarily mean you won't get sick a few days later. And I think maybe they just got a little too comfortable with that. So it will be very interesting to see if Republican lawmakers who have largely refused to wear an outward sign of taking the coronavirus seriously, many of them have refused to wear masks even when asked, if that changes after the president's diagnosis.
Yeah, the president, obviously all of our viewers saw him as he left the White House wearing a mask. I think that is only the second time that I recall having seen the president in public before reporters wearing a mask and not taking it off at any point. Obviously now with the coronavirus diagnosis, it becomes all the more important that he does in fact wear that. Christina Ruffini, thank you.